Hello everyone. Today we are going to see about chronology of primary and permanent dentition. What is chronology? The science of arranging events in their order of occurrence in time. Chronos means time and logos means study. A study which deals with the timing of various stages of tooth development from initiation of the first dental tissue laid down to emergence of the tooth in the oral cavity and its completion of calcification. Let's see about the case scenario 1. A 6-month-old baby girl refused to drink milk and she was crying overnight. Her mother noticed a small red area in her lower jaw, so they decided to visit a dental clinic. What could be the reason? Yes, eruption of primary teeth will accompany these signs and symptoms. Let's see about the sequence of eruption. First, evidence of calcification will happen, then crown completion, and finally there will be the eruption of permanent teeth. After the eruption of permanent teeth, the root completion will happen, then shedding of primary teeth will occur, then eruption of primary permanent teeth. What is meant by eruption? Eruption is nothing but the emergence of teeth from the gums when approximately 2/3 of the root is formed, and the emergence from the gingiva into the oral cavity occurs when 3/4 of the root is formed. Calcification. What is calcification? It is calcification of the primary teeth begins from 13th to 16th week after fertilization, and by 18th to 20th week all the enamel organs of primary teeth get calcified. The permanent crown takes 2 to 3 years from the initial calcification to root formation, whereas the primary teeth take 1 to 2 years for the root completion. Now let's see about the different type of dentition. Primary dentition, mixed dentition and permanent dentition. There is also called as prenatal dentition. The first indication of tooth formation occurs as early as the 6th week of prenatal life, when the jaw have assumed their initial shape. Mandibular arch is larger than the maxillary arch and the vertical dimension of the jaws are little developed. The shape of the prenatal head varies considerably. All the stages of tooth formation fill both the jaws during this stage of development. Let's see about the primary dentition. It is also called as milk teeth. There are 20 primary dentition. Emergence of primary dentition is very important for the development of oral motor behavior and also for the acquisition of masticative skills. At this time of development, there will be the presence of teething problem. The child will have to learn regarding the mastication. Mastication is highly dependent on the stage and development of dentition, and it also depends upon the type and number of teeth present and occlusal relationships, then maturation of the neuromuscular system, which is also controlled by the factors such as diet. Not all the teeth will develop at the same rate, and some teeth are completed before the other teeth are formed, which results in the different types of eruption. Some of the primary or deciduous teeth are undergoing resorption while the roots of other teeth are still forming. So let's see about the sequence of emergence of primary teeth. First, central incisor will erupt, then followed by it lateral incisor, then first molar, then canine, and then finally second molar. This is the eruption chart which shows the eruption of central incisor of both maxillary and the mandibular arch. Let's see in detail. In mandible, the central incisor will erupt around the month of 5 to 8. In maxilla, the central incisor will erupt by 6 to 10 months. Then, followed by it, in mandible, the lateral incisor will erupt around the month of 7 to 10. In maxilla, around the month of 8 to 12, your lateral incisors will start to erupt. Then, your first molars will erupt around the month of 11 to 18 in both maxilla as well as in the mandible. Followed by it, your primary canine will erupt around the month of 16 to 20 in both maxilla as well as in the mandible. Second molars will erupt around the month of 20 to 30 in both maxilla as well as in the mandible. To understand this easily, there is also called as rule of 4, which helps to memorize the eruption age of primary dentition. We also have natal and neonatal teeth. Teeth present at the time of birth is called as natal teeth, while the teeth erupts after the 30 days of birth is called as neonatal teeth. There are certain reasons in which a superficial position of teeth germ which predisposes the tooth to erupt, or it can be associated with systemic condition, or sometimes the tooth germ may be located below the alveolar bone or above the permanent tooth germ. Let's see about the importance of primary dentition. The primary dentition is very important to create a neuromuscular control movement of mandible which requires the presence and articulation of the teeth. The contact of opposing first primary molar is the beginning of development of occlusion and neuromuscular substrate for more complex mandibular as well as the tongue functions. Now let's see about the transition to the mixed dentition period. Till 6 years from the dental arch remains relatively constant without any significant changes in depth as well as in the width. There will be the slight increase in the intercanine width which occurs at the time of primary incisors or lost, and increase in the size in both the jaws in the sagittal direction is consistent with the space needed to accommodate the secondary teeth. An increase in vertical dimension of facial skeleton occurs as a result of alveolar bone deposition as well as the condylar growth. At the first part of the transition period, which occurs at about the age of 8, the width of mandible will approximate the width of neurocranium. Let's see about the mixed dentition period. So mixed dentition period will begin with the emergence of mandibular first permanent molars and ends with the loss of all primary teeth, which usually occurs between the age of 11 to 12 years. Let's see about the importance of shedding. Primary teeth are in use and contributing to the health and well-being of individual during the first years of greatest development physically and mentally. There are certain conditions which is affecting your shedding, which includes dental caries, which creates the premature shedding, and sometimes there will be the retention of primary teeth and congenital absence of teeth, dental anomalies and insufficient space. So these are the factors which is going to affect the normal shedding period in a primary dentition. Usually, your maxillary central incisor will shed by the age of 6 to 7 years. At the same time, your mandibular central incisor will also shed by the age of 6 to 7. Followed by it, your lateral incisor around the age of 7 to 8 it will shed. Then followed by it, there will be the shedding of canine in lower mandibular canine around the age of 9 to 12. In case of maxilla, the canine will shed around the age of 10 to 12 years, and your first molar in maxilla will shed by the age of 9 to 11. In the same, your lower arch also, the first molar will shed around the age of 9 to 10. Your second molar will shed by the age of 10 to 12 years in both maxilla as well as in the mandibular arch. Let's see about the case scenario 2. While playing in the park, a 6-year-old boy had a fall and he got injured and lost his front teeth. He started crying, so then their parents panicked and took him to the dentist. How will you treat this patient? Yes, we have to inform them that 6 years is the age of shedding period of primary teeth. No need to worry, there will be the eruption of permanent teeth. There is another case scenario where 10-year-old boy visits the dental clinic. His mother made a complaint of frequent shedding of teeth from the age of 6. How will you deal with this case? We have to explain the patient regarding the mixed dentition period where there will be the continuous shedding of primary teeth and there will be definitely the eruption of permanent teeth. Now let's see about the permanent dentition. It is also called as secondary dentition. Overall 32 teeth are present in our permanent dentition. The first teeth to erupt in our permanent dentition will be our mandibular first molar as well as your maxillary first molar. Followed by it will be your mandibular central incisor as well as your maxillary central incisor. Then lateral incisor in both maxillary and mandibular arch. Then your canine will erupt in case of mandibular arch, and in case of your maxillary arch, your first premolar will erupt. Then followed by it, your first premolar will erupt in mandibular arch. Then followed by it, your canine in your maxillary arch. Then second molars, and finally your third molar will erupt. This chart shows the complete eruption of maxillary and the mandibular teeth. The first teeth to erupt in your mixed dentition will be your mandibular as well as your maxillary first molars. Then followed by the age, there will be the continuous eruption of permanent teeth, and also there will be the shedding of primary teeth, which follows until the complete eruption of all your permanent teeth. The permanent teeth will occur in the place where there is the previously occupied by your primary teeth. Around the age of 11 years, almost there will be the complete shedding of primary teeth and permanent teeth will completely occupy both your maxillary as well as your mandibular jaws. By the age of 12 years, your second molars will erupt. Then around the age of 21, that is from 18 to 25 years, your third molars will also erupt. This forms the complete dentition. So you can easily understand this eruption age by marking the timeline according to the years of eruption, and it can also be followed by the sequence of eruption in both maxillary and the mandibular arch. Now let's see about the case scenario 4. 24-year-old male patient visits your clinic with swelling in his left cheek, and he also complained that he was not able to chew any food on the left side for the past 3 days. What could be the reason? Yes, the eruption of third molar can accompany these symptoms. A 14-year-old girl presented with a notched upper front teeth. The notch were present ever since the tooth erupted in the oral cavity. Her postnatal history revealed that she was hospitalized for a prolonged period around the age of 1 to 2 years, and the child suffered from severe malnutrition and required hospitalization for 2 weeks until proper recovery. On clinical presentation, we could able to see multiple symmetrical chronological pattern of tooth calcification and linear ring-like pattern involving all the surfaces of teeth. The diagnosis is said to be chronological hypoplasia. That is, the chronological pattern which showed the systemic illness would have occurred around the age of 1 to 2 years, and this coincides with the patient's hospitalization history. Malnutrition is to be believed to be the cause of hypoplasia. Let's see about the clinical importance of chronology. Age of attainment. So based upon the tooth emergence, we can calculate the age, and it is used to avoid the damage to developing tooth during the treatment. Then it can be also used for predict the age. Based upon the average age of the individual in the stage of development, it can be used to identify the age of the patient during forensic assessment. And the dental age can also be used for the maturity assessment according to the stages, which is average, then the subject ages. Let's see about what is dental age. Dental age can reflect an assessment of physiological age comparable to age based on the skeletal development, weight and height. When the teeth are forming, the crown and roots of the teeth appear to be tissues least affected by the environmental influences like nutrition, endocrinopathies, etc. When a substance such as antibiotic tetracycline is ingested by the mother during certain times of the development of dentition, significant discoloration from the yellow to brown to bluish violet can be seen from the cervical part to all of the enamel. Let's guess the age. The middle picture, in this picture we can able to see the mandibular central incisor, that is your primary dentition is erupted. So the age of the patient could be 5 months. Here you can able to see the mandibular as well as your maxillary primary central incisors are erupted. So the age can be between 6 to 10 months. The third image, we can able to see all the primary dentition have been erupted, and we can also able to identify the eruption of permanent maxillary central incisor as well as your mandibular central incisor is also started to erupt. So the age of the individual could be 7 to 8 years. In the last image, you can able to identify the third molar. So the age of the individual can be between the range of 20 to 25 years. Thank you.